What is my blood pressure, and what does that mean for me?
What is my risk for heart disease?
What are my cholesterol numbers, and what does that mean for me?
Is the measurement of my waist really important? And how do I measure my BMI?
What is my blood sugar level, and does it mean that I'm at risk for diabetes?
What other screening tests for heart disease do I need, and how often should I return for checkups?
How can I quit smoking?
How much exercise do I need to protect my heart?
What should I eat? And should I see a professional to learn to eat healthier?
How can I tell if I'm having a heart attack?
When I first put on this white coat, more than 30, well almost 40 years ago, most of the patients who came through my door were men. People thought of heart disease as a man's disease, so men were more likely to go to a cardiologist or call 911 if they had symptoms they thought might be a heart attack. Hi, I'm Dr. Richard Gray, and I'm the Medical Director of the Tyler Heart Institute at Community Hospital of the Monterey Peninsula. That kind of gender information gap about heart disease still exists, but the gap is narrowing. More women know that the biggest threat to their health isn't breast cancer or stroke or lung disease. The #1 killer of men and women is the same, heart disease. In fact, more women than men die from heart disease each year, and it's not just an older woman's disease. It's the third leading cause of death among women ages 25 to 44. When it comes to heart issues, it's not exactly like men are from Mars, women are from Venus, but there are differences in how and why heart disease develops, the symptoms of a heart attack, and the treatment for women and men. We all know the usual suspects that increase your likelihood of heart disease: family history, a diet high in saturated fats and cholesterol, and not moving enough. But there are also things that play a bigger role in heart disease in women than in men: depression and stress, smoking, hormonal changes, specifically low levels of estrogen after menopause, use of high-dose birth control pills which may cause blood clots, metabolic syndrome, which is diabetes linked with fat developing around the abdomen, also lipid profiles with low HDL, the good cholesterol. While men are more likely to have their blockages in their main arteries, women often experience what's called microvascular or small vessel heart disease, blockages in the smaller arteries that supply blood to the heart. As for symptoms, women, like men, may have chest pain or pressure, but compared to men, they are somewhat more likely to experience things like shortness of breath, nausea or vomiting, pain in the neck, shoulder or upper back, and fatigue. So now that we've closed the information gap and you know that heart disease is a woman's disease, what can you do? We've compiled a lot of information on the Community Hospital website, chomp.org, including a calculator that will help you determine your risk of a heart attack and details of the many services at Tyler Heart Institute. We also have a list of questions from the National Institute of Health that you can ask your doctor. Getting the answers to these questions should help you determine what changes you can make to lower your risk of heart disease. Thanks for investing in your heart, and please come by Chomp anytime. My door is open. I'd love to have a chance to meet you in person.